welcome to OneMDHealth, where science truly meets soul. So this is about talking about functional medicine versus conventional medicine. It is a place to explore the contrast between conventional medicine and functional medicine. And it's not so much to just say which one is better or which one is wrong. It's more about like understanding both types of medicine and to figure out that we need both. So I want to use this space really to talk about longevity and what does that mean exactly? Well, it means let's talk about hormones, let's talk about vitality, let's talk about aging well. It is not so much about aesthetics, but it's really about aging well. So as a conventional medical doctor, I am a hospitalist and I work at Elmer's Hospital, and I've been doing that for about 18 years. And I find conventional medicine to be very rewarding in the fact that I save lives every day. I help patients deal with serious medical issues such as heart attacks, cancer, inflammatory bowel disease, things that really acutely make them feel sick, unfortunately, where they have to be admitted into the hospital and they require IV antibiotics. They require for their lives to be saved. So it's very rewarding. However, there was definitely a missing component, a missing piece. And what I found is that the problem with conventional medicine, healthcare in general, is that we are doing an acute care model of medicine on chronic medical conditions. So the acute care model works wonderfully to save lives. It works wonderfully to help with heart attacks, to help with pneumonia, to help with cancer-induced chronic medical conditions that have you be admitted to the hospital. But what it doesn't do well with is that our day-to-day issues of chronic medical disease, for example, the diagnosis of diabetes, diagnosis of perimenopause, the diagnosis of even other chronic medical conditions, we are told that it's just aging. We are told is that everything looks fine. We are told that we just have to deal with it. That's just the concept of aging. So when you establish an acute care model on chronic medical disease, it does not work. And then what you find is patients feel like a lot of this is a Band-Aid, that it's not really addressing their root cause of why they don't feel very well. So I've been practicing functional medicine, lifestyle medicine, longevity medicine for about 3 years. And so on my time when I'm practicing this in the city, I see my patients and I swear they almost remind me of my patients in the hospital, but just 20 years younger. So for example, I had a patient that I saw a few months back who, and honestly, most of my patients are like this. It was like 45-year-old female coming in with issues of weight gain and fatigue and losing a sense of herself. All of a sudden, she woke up one day and she noticed that she could not eat the same foods like she used to back in her 30s and 40s. Her energy completely went down. She started losing hair. She started noticing her skin wasn't as viable as it used to be. And it wasn't so much of aesthetics, but it was also the fact like joint pain came out of nowhere and she was gaining weight in places where she never had issues with. She noticed weight gain mostly around her tummy, definitely in the inner thighs, and she noticed that no matter how hard she exercised, nothing seemed to bring the weight down. And she felt that this weight was very resistant to no matter how much she dieted, no matter how much she took care of herself, she just was not losing the weight normally like she would when she was in her 30s. So she went to her medical doctor and she was also having some GI issues. She was having constant bloating, constipation, and sometimes she just would not want to eat. And so she went to her medical doctor, and this is not to say that medical doctors don't care. They do. However, when you are fully booked with almost 20 patients in the clinic and you literally only have 17 to 20 minutes to spend time with the patient, how can you address everything? You simply cannot. So it's not a failure to the primary care physician. It's mainly the failure of the healthcare system because our healthcare system, unfortunately, is not designed to treat chronic disease. It is designed to treat acute disease, basically sick care, basically what I do in the hospital. Our healthcare system does that very well. As a medical doctor in the hospital, I treat patients very well, very efficiently. I save them when they need saving. However, what happens when every day-to-day life just feels misery? And then you try to apply that acute care model to chronic medical issues. It does not work. So getting back to my patient, she went to her primary care physician, and her physician said, well, your labs all look normal. Your cholesterol looks normal. Your thyroid looks normal. You are at a healthy weight. Yeah, there is some weight gain there, but body changes as you age. You just got to get used to it. Well, she didn't accept that. She's like, well, my joints hurt. Everything hurts. Well, everything starts to hurt when you age. That's what her primary care physician said. And they said, well, there's nothing more I really can offer you. And then she started to tell her primary doctor, well, I don't enjoy life like I used to. I don't have a zest for life. My hair is falling out. I'm gaining weight. I feel like I'm yelling at everybody in my family. I feel like I have a low tolerance to everything. And basically her doctor said, well, would you like to be put on an antidepressant? Maybe that will help you. That is a concern. And then they go through these questions. Do you want to hurt anybody? Do you want to end your life? All these like suicidal questions they ask. Obviously, the patient is like, no, I don't have those feelings. I just feel flat. Well, they said, well, we can put you on antidepressant if that's what you want, but come back and see me in 4 to 6 months. And she just felt that her real issue just was not being addressed. And she felt that she knew something was wrong with her body. She knew there was a shift, but she just refused to accept that this is old age. So this is where functional medicine comes in, and this is why it's becoming so popular recently. It's basically everything that I've always known, even as a medical doctor. So I've always had these certain principles. Nutrition is foundation. Gut health is foundation. Being around people that love and respect you is foundation. Those are feel-good hormones that get activated for that. Exercise is foundation. Decrease in risky substances is the foundation, which basically is lifestyle medicine, foundation. Functional medicine is cellular health, what is going on inside your cells. So patients are demanding more now. They want more now. And so this 45-year-old female, she came to me and she said, listen, I hope you are not like any other doctor that tells me I'm fine. I don't feel fine. I don't want to accept that weight gain is just part of aging. I know where weight gain leads to. It leads to diabetes. It leads to insulin resistance. It leads to high blood pressure down the road. I have high blood pressure in my family. I don't want to have continuous gut issues. Why can't I eat the foods I used to like when I was younger, and we're not talking about processed foods. We're talking about certain foods, spicier foods, or even just a little bit more high fiber foods she could not tolerate. And she was at this point like, I demand answers. I want more out of life. And I'm in my 40s, and that doesn't mean my life is over. So really, why functional medicine is taking such a huge interest is that midlife doesn't have to be over, and patients are now demanding more from their doctors. And I'm all here for it, because as a medical doctor, those are the principles I live by. In fact, those 5 principles that I lived by is what got me through hospital medicine, is what actually helped me take care of other patients when they were dying of heart attacks, when they were dying of pneumonia, influenza, and even during the COVID-19 pandemic. So because I had those 5 principles in place, I was able to go about my stressful job day to day. So I am all here for patients really wanting and demanding answers for things of why their health has deteriorated. And this is just one factor. So what I did for her, I told her that you are not crazy, and you are not alone in how you are feeling, and you have every right to feel well in midlife. Midlife actually is not the ending. It's actually an awakening. It's an awakening of a new era. It's an awakening of really being who you truly, truly are. So patients, men and women, that come into my office really are demanding more because they realize that, and they're more in tune with their bodies. They are not just accepting that this is old age and that they should just forget about living a better, more quality of life. This is not to say that they want to be 20 again, they want to look that way again. Some do, but most of them are like, I want to be able to function. I want to be able to get up in the morning and not have back pain. I want to be able to exercise like I used to and have the same resilience back in my 30s and 40s. I want my metabolic health to be better, and I want to address it now before 20 years later, I'm seen in the hospital where I'm dying of a heart attack, I'm diagnosed with cancer because I did not have the proper tools or the proper guidance on how to take care of my health. So when I'm in the hospital and I see patients, unfortunately, already there, they're already in full-blown diverticulitis, they have acute blood clots, they have heart attacks, they have heart failure, they're diagnosed with cancer, and at that point, it's at that point where they're literally in survival mode, and you're literally sustaining life rather than really healing life. So a lot of my patients that come to the clinic, they maybe have seen loved ones, whether it was their mom, their uncle, their brother and sister, going in and out of the hospital, 5 years older than them, 20 years, 30 years older than them. They tell me, Doc, this is what my mom complained about when she was my age. And now she's had 2 heart attacks this past year. I don't want to be that way. I don't want to live like that. I want to address this now. And why are we not addressing nutrition? Why are we not addressing exercise? Why are we not addressing nervous system regulation? Why are we not addressing decrease in alcohol and smoking? We do a little bit in our visits, we do. But how about really addressing it, why it's terrible for you, understanding the pathophysiology of what it does to your metabolic health, your cells, your organs, even your mental health. Why are we not addressing all this? So patients are demanding more, and that's where functional medicine comes in. So what we did for this female, this patient of mine, I first validated her feelings, told her you are not crazy. These are very real issues. But I also was very firm with her. Whatever you did in the first 45 years, you may have to change your lifestyle a little bit if you really want to achieve great results. That is one thing I do address with all my patients. Never go to a doctor that says that they can do miracles just by giving you a medication, whether it be a pharmaceutical medication, whether it be a weight loss medication, whether it be peptides. Those things help, but those things are tools, and they are not the whole treatment plan. So I told her, you will most likely have to be able to change your diet. You most likely have to prioritize rest, and you have to prioritize exercise, and you will have to prioritize nutrition. We all get busy. We all have a busy day. But just that self-awareness alone, you will have to do that. And so she took that a little bit, oh, wow, I did not think it was that much of a big deal. And I think that's where functional medicine comes in, is that everything you do day to day, the thoughts you think about, what you eat, how many hours you sleep, who you hang out with, what you put in your body, processed foods, alcohol, smoking, whatever you do, this all affects your health. It is not just about supplements. It is not just about peptides. It's not just about weight loss drugs. It's not just about biohacking. That is great. I get it. I'm all for it. But if we're not doing the foundation, there is no point in doing the fun stuff, because the fun stuff will not work without the foundation. So that's the first thing I did tell her, that lifestyle is a key factor in all this. So I asked her a lot of questions during the initial consultation. I asked her, so what do you do when you get up in the morning? First thing when you get up in the morning? Well, Doc, I reach for my phone. Okay, you reach for your phone. So you don't get up and maybe open the door or open the window for some sunlight. No, not really. I get up and I look at my phone and I think about what I have to do the whole day. All right, so we're already starting our day in fight or flight, all right? And then I asked her, okay, what do you have for breakfast, lunch, and dinner? So she tells me exactly what she eats for each day, and I'm realizing she does not acquire enough protein each day. And she's like, protein? But I mean, I grab a cup of coffee and I'm lucky that I make it to my job on time. I need something to stay awake. I don't have time to even grab anything for breakfast. I'm lucky if I eat lunch. Then by the time I do eat lunch, I'm starving, so I just grab whatever I can. Okay, all right. And then what do you have for dinner? Well, I get home so late that I don't even have time sometimes to eat dinner, and I eat dinner really, really late. Like, okay. So see, there's a problem right there. Is about adjusting lifestyle. It's like we are so in tuned about how we have to get to jobs on time. You know, that this culture is just such hustle culture that we don't even have time to take a deep breath after we wake up in the morning. So, how do you expect your body to feel safe to heal? How do you expect your body to feel safe to lose weight? It's going to grab onto every calorie you feed it because it's in survival mode. It is just the way the body reacts and responds. So functional medicine, I address how your body's responding to everything you're doing to it, what you're feeding it in your brain, what you're feeding it in your digestive system, and exactly what you're not feeding it. So what I do, I actually ask the questions, all right, what is it that you do each day that has contributed to your weight gain now, your hair loss now, your fatigue now, and your mood issues now, and your digestion? Very similar, very simple. So then she recognized that, okay, maybe I don't have the healthiest lifestyle. I work out when I can. Okay, well, what do you do? Well, I work out once a week when I can do it. Do you lift weights? Not really. I don't want to get bulky. Okay, you don't want to get bulky. But however, you need muscle mass in order to look lean. That's another issue I see with patients, is that they feel if they put on, they'll look bulky if they put on a lot of muscle. But what you guys don't realize is that muscles are total longevity organ. And especially in midlife, muscle is everything. Muscle helps us age better. Muscle helps skin quality. Muscle helps hair growth. Muscle is fuel for our cells and our organs. And the most important thing, when you are in your 60s, muscle is going to be able to help you get up from a chair, just like this. Because it's not so much about aesthetics anymore. It's more about, am I going to be able to keep up with my grandchildren as they get older? Am I going to be able to wake up and not be in a wheelchair or fall and break a hip and have to go to physical therapy or rehab and then have my insurance reject it? Because that's what I deal with in the hospital. So everything is linked. And that's what functional medicine is. Functional medicine is that everything is one. Everything is whole. The whole body system works together as a whole. Where conventional medicine is symptom treatment. Okay, you have a heart attack, here's a beta blocker, here's a statin. You have diverticulitis, okay, here are some antibiotics. It'll relieve the infection. You have pneumonia, here are some antibiotics. And I'm not to say conventional medicine doesn't work. It does work. I do it, and I've saved a lot of lives. But once we save that life, where's that quality of life after that? Where are we getting after that? And that's where conventional medicine is important, and lifestyle medicine is very important. It's like, what happens after we save that life? Where is that quality of life? What have we taught our patients or guided our patients of nutrition and exercise and nervous system regulation, being okay to rest, getting rid of hustle culture? When have we guided them that that is how you keep out of chronic disease? So it's not even getting into blood work yet. We're just getting into lifestyle. So now let's get into blood work. So I told her we're going to be doing more blood work. We're going to be going beyond just checking TSH for thyroid. We're going to be checking free T3, total T4. We're going to be checking thyroid globulin. We're going to be checking antibodies. We're going to be checking liver markers. Is your liver able to process hormones? Able to process toxins? How is your liver doing? Yes, then we're going to do the gut microbiome test, which is the stool test, which is the most important test. 80% of our immune system lives in the gut. All of our feel-good hormones, serotonin, GABA, is all synthesized in the gut, 70-80% of it. So if you don't feel well and your mood is off, it's most likely your gut. Definitely it's your gut. So why aren't we addressing this? So We did blood work, stool testing, micronutrients. She comes back after a month when all her blood work comes back. And it turned out that she had severe gut dysbiosis and SIBO, spontaneous intestinal bacterial overgrowth. She was in perimenopause where she did not have hardly any progesterone to combat the estrogen that she was making still inside her body. So it's not that her body was making more estrogen. It's just that her hormones were all over the place and the estrogen was not being tamed by progesterone. So that explained the mood issues. That explained the sleep issues. It even explained the weight issues. And the weight issues actually came from the gut because if the gut is inflamed, if you have bacteria that do not belong in your gut, that in itself creates a lot of inflammation. It basically creates an inflammatory environment where, unfortunately, your body, particularly your gut, cannot clear any excess estrogen. So what happens is the estrogen is recirculated back into your bloodstream, worsening symptoms of perimenopause, worsening symptoms of weight gain, and worsening overall well-being. Then at the same time, cortisol shooting up because she wasn't resting. She was working like an 80-hour work week, and she didn't allow time for any kind of downtime for her body to even heal or to even want to lose weight. So when I explained to her that it was mainly her gut that was causing all her issues, it's much bigger picture than just her hormones. She was saying to me, "Really, is this possible?" And I said, yes. I put her on a gut protocol for 3 months. I put her on a protocol that consists of, okay, there's 3 things we need to do to repair your gut. We need to remove anything bad, repair the gut lining, and replete with probiotics or any other digestive enzymes or anything else you need. And I put her on that protocol for 3 months. She comes back to me in 3 months. She feels amazing. She lost about 10 pounds just by doing that. We talked about lifestyle measures. She incorporated more strength training twice a week. She made sure she got up in the morning first thing without looking at her phone, got her workout clothes on, and she managed, and she put this as a priority before she went into the office. Half an hour, at least twice a week. That's all I asked for. 30 minutes, exercise, weight training, do something. And then after that, she also became more self-aware, more fruits and vegetables, incorporating at least 30 grams of protein in each meal. Obviously, 35, 45 is optimal, but you always have to meet patients where they're at. That in itself, and those changes, she lost 10 pounds. She felt amazing. And she told me, doc, I don't want you to put me on hormones or any peptides. I want to see how I do it on my own. Then as 3 months later, we had a follow-up. And because she incorporated more of this lifestyle change, she was able to balance her hormones. She feels great. So what I'm trying to say is most patients in my office turn out to be like that because a lot of them are motivated and they want to heal and they don't want to be like their parents or their grandparents or even their siblings who are in the hospital where I see them. So this is why functional medicine is gaining attention, because it works. Lifestyle medicine is the same. Conventional medicine didn't exactly fail us. It is very important. We need that. But in functional medicine, this is a very important component that we have to think about. So now what is the dark side of functional medicine? Yes, let's talk about it because there's always a dark side to any type of medicine. So here's the dark side of functional medicine and why some clinicians don't trust it. Functional medicine is gaining a lot of attention right now. However, unfortunately, the practitioners that are in this space, some of them cannot all be trusted. Now, that does not mean that some doctors in the conventional medical space can't be trusted. That's true. But I'm telling you the issues that some clinicians have about functional medicine, and I do want to talk about them. First of all, we get this bad reputation that we put all these patients on a bunch of supplements. We charge patients with these expensive protocols that don't even work just because we want to make money. And here at OneMDHealth, this is what I talk about. I talk about raw conversations, things that you're thinking, but you won't say. Because I will say it, because I can, and it's my space. So this is what I want to say about it. I understand that concern. I understand that issue. And I can honestly tell you there are actually a lot of great functional medicine doctors out there that don't want to overcharge you with these expensive, ridiculous protocols that don't work, that are just about feeding you a bunch of supplements that don't work. That is not what all of us are about. In fact, the ones I definitely are around, they do not do that. And the doctor that trained me, she is definitely not like that. And that is actually why I work in that space, because I like to be around the functional medicine physicians that I deeply trust and respect. But yes, we get this bad reputation that we put patients on a bunch of supplements that they can't possibly digest. We charge them all these expensive, fancy, schmancy protocols that do not work, and we just send them on their way and have them more confused. That's not how I practice functional medicine. The way I practice it is I see both worlds. I see the conventional medical world and the functional medicine world, and I put both worlds together, and that is my concept of medical oneness. That is the concept of OneMDHealth, is medical oneness, where you take the good parts of conventional medicine, good parts of functional medicine and lifestyle medicine, and you bring together and you come up with a personalized care plan for the patient that works for them. No care plan will work and look the same for every patient. For example, most complaints of patients, they come and talk to me about, I'm gaining weight, I'm very tired, I'm not sleeping, I feel irritable. Well, the treatment plans are not the same. The complaints are the same, but the treatment plans, the personalized care plans, are so different for each one of my patients. So I don't practice medicine that way. I practice medicine where you look at the whole person and you use the skills that you learn. I use the skills I've learned in conventional medicine, that I've learned in functional medicine, and I come up with the care plan that suits your lifestyle, that suits your needs, and where you are at. So it is not about prescribing a whole bunch of supplements. It is not about charging fancy packages, hoping that seeing what sticks. It's really about, how can I personally help you to feel amazing again in midlife? Midlife or not midlife, I just want my patients to thrive and feel amazing, so I don't see them 20 years later at the hospital where I do have to save their life and where, unfortunately, it could be too late. So that is the drawback of functional medicine. The other drawback and concern of functional medicine is resources. Let's really talk about this. Resources of where they get their supplements, their weight loss medications, their peptides. Let's really talk about that, because peptides are everywhere, right? We love to talk about peptides. Oh my gosh, every TikTok influencer is all about peptides. My patients hear about peptides. Well, this TikTok influencer was talking about it. Well, this Instagram influencer was talking about it. Please stop. Please stop. Don't. Do not take a peptide without proper supervision from a medical doctor who has experience in it. Yes, like myself, I have talked to pretty much almost every peptide company. I have researched pretty much a lot of the peptide companies, and I only work with 2 peptide companies that I trust. And there's a reason for that, because a lot of my patients get peptides and hormones and weight loss medications from other sources. And when they come in and they tell me they've hit a plateau, it doesn't work. So after healing their gut, addressing their nutrient deficiencies, changing the lifestyle, which matters, I put them on the peptides that I use and that the companies, the compounding pharmacies I trust, the weight loss medications that hold my name. And first off, they don't need as much of a high dose, and it works just like that. And without a proper supervision from a physician, it's not going to work. So that's the drawback, dark side of functional medicine, is like, where are these clinicians getting their supply? Because you have to be very careful of the supply of the compounding pharmacy, of how they make their peptides and how are they regulated. And same with weight loss medications. There is a lot of fraud out there, unfortunately. And you have to be seriously careful as a consumer, as a patient, of what you put in your body. So there is a drawback of functional medicine. So then patients are left with, well, who can we trust? There's so much out there on the internet, media, Instagram. Trust medical doctors, medical supervisions, and word of mouth. And that's why this podcast is so important to me, because I want to get the word out there. We have to get the word out there that there are good doctors out there. There are good physicians out there that do care about your well-being, care about your health. They're not just about making a profit. They're actually about healing you. So I hope this podcast episode resonated with you, and stay tuned for more episodes and more changes. And I will be talking about a great announcement in the next podcast. So great things to come. Thank you for your time. Until next time. Thank you for visiting OneMD Health Podcast. Please like and subscribe. If this podcast resonates with you, please share it to whomever you feel would benefit from this. If you have any questions, please visit my website, SamiyaHashmiMD.com.